So it's 7:30, so we can get started. The meeting is called to order, and we have a quorum, so we can proceed. And so did everybody have a chance to look over the minutes? Motion to approve them?
Motion to approve.
Second. All in favor? Any opposed?
I would maybe just ask if anybody's on the line.
Is anyone on the line? I didn't hear any beeps. That's why we had some music.
She was going to call in.
Okay.
So.
Okay.
Okay.
So it seems we can have your report.
Sure. So we are starting the budget process for next year. So we're inputting sort of our figures on what we think. We don't think we'll be requesting any significant staff changes or anything like that. So it'll pretty much be a similar year-over-year kind of budget request. So no big changes there. We did have a booster clinic on Sunday, November 6th. That was fairly well attended. So we're continuing with that. We're sort of bracing to see if, there's been statements from CDC about flu activity being dramatically higher, and especially the southern states. So we'll see if that drives a need for us to have additional flu clinics. Typically it does when people hear that, there's more activity than usual.
So already.
Yeah, we're seeing a lot of work already, yeah.
Some of it, more than COVID, actually.
Yeah, I mean, they're saying, the report I heard this morning was higher than 2009 levels, which was, the initial H1N1 craze. So we're ready for that. We've got our staff ready to continue with that. We did get back from the state of Connecticut some annual report feedback. So this is the annual report. We submit an annual report to the Department of Public Health every year. They have a prescribed format, and we upload certain documents to support our, assertion that we do certain activities. They say, okay, well, show us a policy that demonstrates that. And so, we were not, 100% perfect in there. They said, some of these documents that provide evidence don't quite demonstrate this service. So some of it, good evening. So which is fine. And they provided us with a whole host of best practice examples. And so, for example, I'll give you the level of scrutiny was, the document you provided doesn't demonstrate 24/7 doesn't demonstrate 24/7 access to the state lab, because we included an incorrect email. And they said that email is only monitored during the day, and and the best practice is, we'll change it to this email and you'll be okay. So it's like that level of correction, we're like, we can live with that. All right, we got knocked for that, but we'll, so we can revise that. And we have, the annual report for this past year is, while they haven't submitted it's a survey that we fill out. Haven't submitted that yet, but haven't provided that to us yet, but we'll be able to make those changes. And we've already had a meeting and reviewed the best practice example document. So we'll hopefully do better this year and move forward with that. The Medical Reserve Corps grant that we received, we continue to work on that. We've had a few meetings with the state on that. So the next phase, we'll be sending out letters to our Medical Reserve Corps about background checks. And so the two components of this grant will require us, and the requirements of the state will be that we transition everybody to this new CT Response database. So we've uploaded all of our volunteers into that database, and now it'll be a component of, we have to run background checks or start the process of running background checks. But before we do that, we have to send out a letter and get everybody's permission to run background checks. And so what we're fearful, and when we tried to explain to the state, is we're going to lose a lot of people. They're going to say, no, thank you. Regardless of whether they're fearful of anything coming up or not.
Think so?
I think we will, yes. Some people will just say,
enough.
It's enough, because they want more information. You have to provide, it's the level of details, and they want, and I forget the specifics, but, they want your social security number, they want your driver's license number, your birth date, So they want certain details, and that's what people will object to providing, some state database that they don't really understand, and like, oh yeah, we're plugging you into this new database that you know nothing about, and now we want more information. And so that'll be the driver to limit our, when we send this out, I'm sure we'll get some people to say, thanks, but no thanks, I've enjoyed serving, but especially those who haven't really responded or anything. It's just, the state is saying that's the requirement, you're gonna have to do this, We've tried to say, can't you, for people that have been a member of our group for 15 years, 17 years now, can't they get a pass? And they're saying no. And so we're going back and forth with, well, we'll see the impact of it and then decide like, all right, well, do we not, is there a way around using this system that we don't have to do that? So, but I don't think so. But so we'll have to go through that. And the grant that we received is actually a recruitment grant. So we'll try to recruit new people, and that'll be part of the deal with signing up. Is you sign up through the system, and that system asks all that information. And so,
does that grant money cover the background checks also, or does the state police do them for no charge? How does that happen?
The state system does the background check, and it's all included in using that system. That's one of the benefits. They do licensure check the system does licensure checks and background checks for you. So you have to go in and go to each volunteer and say, submit background check. And so, but it will necessitate a policy at some point to say, what if somebody comes back with something? Is it an automatic pass, or do we review what it is and say, okay, we accept this volunteer even though there's some activity that came up in their background check? So we'll have to sort of look at some policies and to try and deal with that once we get more into the process. We're probably just going to run it on, like myself and some of our staff that are the leadership of the MRC that are in the database, and see how it comes up. I may have to, kick myself out, but hopefully not. So
is there already some exclusionary criteria that you have for the MRC at a baseline, or not really?
Breathing?
Okay.
Is one. We don't really have any exclusionary criteria. So we've said since the start of the MRC, it's really this is our Hail Mary list. That we're going to call you when something's really bad. We're not going to bother you with the runs and doing the first aid tent at the marathon. We're not going to do any of that. This is our list. We just want your contact information so that if something really bad happens, we can call you. And we offer things. Typically we try to have it's been lax for a couple of years now with the COVID, but we typically have like a training session a year, and then we usually offer some kind of drill or exercise participation every year, or a real event participation, which we've done several of since 2005 starting. So, we've had entirely volunteer-run flu clinics where it's all MRC members, with just one town staff there overseeing the medical aspect of it and one seeing the non-medical aspect of it. We've had them do, activities related to H1N1, to, a variety of different activities, and a lot of COVID activity. That's been sort of the history. We don't really exclude anybody other than, in some cases we found people challenging to work with, difficult personalities, and we've tried to limit their placement in certain roles. We found, in certain clinical aspects, we found people out of practice, if you will. Some of the folks that have been retired for a while, and so we've had, the nursing supervisor kind of meet with them and talk to them about it and place them in roles that are more appropriate for where they are. So, but other than that, we generally don't say no to any medical or non-medical volunteer that we have come in, as long as they understand their role. So we've had some initial discussions. The town has begun receiving the opioid settlement funds, and so we have had some initial discussions internally just about the plans to use, how those funds will be used. I had a meeting with the director of Fairfield Cares about pulling in. And basically what the plan is to sort of pull together the key stakeholders in town that are dealing with substance abuse and prevention activities and get their input on how they feel the funds should be utilized. But also what's happening in other states, shortly after the funds become available, those states have put out guidance documents saying, these are the types of activities we want you to, we prefer you do. And so we've reviewed some of those other documents, and it's largely things like, offer Narcan distribution and trainings around the town and some of those things. And there's some aspects of it where they want you to use some of the funds towards treatment availability, which really isn't within our wheelhouse. So we look to like Therapy Cares and the Hub and others who do behavioral health and substance abuse on a daily basis, and look to them to say, all right, how do we use some of these funds? So it's annually, it's not a great deal of money. It's a little over $22,000 a year, but it's going to be coming for the next 18 years so it adds up to quite a bit of money over time. So we want to make sure that we're using every penny to its maximum value. Health Department is not looking to take any of those funds. We think that's not, we want to just make sure that we feel it's our obligation along with the leaders of the town to make sure it just gets used in the best way, but we don't want to take have any of it come to the Health Department directly.
And the funds come from?
So this is the National Opioid Settlement Funds. So there's two pools of funds that, one was a settlement with the manufacturer and one was the settlement with the distributors.
Like with Purdue Pharmaceuticals, right?
Pharmaceuticals.
Yeah, and so there's two. There's one with McKesson and one with Purdue, and then those are set on different schedules. One is the one we got is the $22,000 for 18 years, and there's another one that's like for 9 years, and I don't think that distribution has started yet. So there'll be some additional funds coming. So we want to, we're looking for state guidance so that everybody in the state is consistent, and we're distributing those funds, so we get the most out of it, so that it does what it's intended. So this is unique in the sense of the tobacco settlement funds just stayed up at the state level, and it kind of very little of that money went towards tobacco cessation, cigarette use cessation, like it was just kind of poured into the general fund and, just disappeared. And so that this settlement was designed so that doesn't happen. Percentages have to go to the local towns and it's a formula based upon, how many overdose you've experienced. In addition, the staff participated in what was called a fair housing training offered by I think that was the EEOC, Equal Employment Opportunity Commission at the state. So apparently at some point in the past, the town was cited for some unfair housing practices. I don't think it was related to our department, but so that there is a requirement that officials in town that are involved in housing-related issues have to participate in this fair housing training. And it was, it was fine. It was just about, ensuring that you're providing fair opportunity for housing and the legal aspects of that. But we had 5 staff participating in that. We had a presentation, so we participated in a jurisdictional risk assessment, what's also called a hazard vulnerability assessment recently, and so the state put out a report just recently and had a presentation over a couple hours the other day about, just basically looking what are the hazards that are associated, natural and man-made hazards associated with the town of Fairfield and the region. And so it comes down to the same types of things that we have been planning for. The biggest concern is always a winter storm with a power outage is sort of the one that's up there in terms of having placing the most demands on the town, and then going down to pandemics and cyber attacks, and so it kind of prioritized that and sort of tells us where we need to plan for, and it's an assessment of where individuals that are involved in emergency response feel they are prepared or less prepared, and so it kind of gives us some focuses our efforts a bit, and so we'll be working on that, incorporating that into our preparedness plans. We also participated in what's called a Web EOC training for local health departments. So Web EOC is the emergency management platform. It's a software platform that the state uses for situational awareness in emergencies and for resource requests. So outside of, for example, for public health, outside of vaccine and PPE, Web EOC was used for any other COVID-related resource request throughout the state, and is typically how, during large-scale emergencies, a municipality would make a request of the state, saying, hey, we need state police, we need National Guard, we need 100 cots, we need whatever it may be. This is the platform where those requests would go in, and where you could review situational awareness about incidents going on throughout the state. So this was, just a training for our staff. We had some turnover the past couple of years, and so we were down to, I think it was just myself and me and you that had access to Web EOC.
I think John too.
And John, and so we added a few more people. Andrea got in there, and Santina, who you've met. And just a refresher on how to use the system, how to make the most of it during emergencies. We did finally drop off the 5 former bike share bikes to Fairfield U and Sacred Heart. They were very happy to receive them. Got them to sign a little waiver for us and say, we'll accept them as is. And so that's one program wrapped up and bow tied on that. So it was great to get those out of storage and get them being used is the best part about it. And then, I had shared earlier about an issue that was consuming our time lately. Rob's been working on this for a bit, and there's an issue going on with the water pollution control facility. So the health department's become involved in that. So just to give you the quick summary, last spring, and I don't know if I shared this before, but I don't think so. Last spring, there was a structural failure to a component within the water pollution control facility. That component failure resulted in one of the digesters not functioning properly, and so they had to change the process that how they process the wastewater that comes into the plant. While the end product, whatever comes out of the liquids that go out into Long Island Sound, or the solids that go into the composting facility and go up into the We Care Denali, where they reuse that product. At the end point, it's the same product, so it's exactly the same. So it hasn't changed the nature of any of that. It's just the internal processing components of the product that comes out and goes into the composting, the WPCF composting facility is more odorous. And they've had to remove some portions of the anaerobic digestion chambers, exposing them to air. And so some of those odors get out, and the product that comes out is a little bit closer. So there's a spectrum of completely raw sewage and processed sewage, and it's somewhere in the middle now, as opposed to completely processed. What comes out at the end of that still is exactly the same, but in the middle, there's a couple processes that are more odorous now. And so we've been getting complaints about those odors, and
you see it on social media.
Yeah, and it's I don't think anybody is just trying to say, no, it doesn't smell a lot more. It smells a lot more, and WPCF, as Water Pollution Control Facility, has hired a consultant to assist with the odor control, and they've tried some things, and they quite haven't got on top of all the odor yet, and so they're working on that. They're making attempts. So the questions came up of, is there any potential health impacts related to that? And so I've had conversations with Department of Public Health, the Environmental and Occupational Health Assessment Program, and they've provided guidance to us saying that, in terms of health impact there, the concern expressed by people is, one, is there anything infectious coming now, or is there any, if it's not infectious, is there anything from the actual odor itself that will elicit health impacts? And the state said, generally that since they aren't being exposed to actual sewage, that there would be no infectious risk to them, no change in their risk of infectious disease, and that the odors themselves, the hydrogen sulfide that produces the odor, and there's a couple other components in there that produce the odor that's typically associated with sewage, is, as they described it, kind of like nail polish. It's at very low concentrations, it's very odorous and can spread very far, and it's generally unpleasant, but it doesn't typically rise to the level where it elicits any kind of health impacts. Is it possible at higher level exposures, especially like people that work in facilities that produce hydrogen sulfide? It's possible that hydrogen sulfide produces health impacts, but at the levels typically associated with the distance and space and time from the sewage treatment plant, that it's not typically associated with any kind of health impacts. Regardless, the town is planning to move ahead with some air testing, and we're working with companies now to get some quotes on environmental testing to confirm what we've been advised is that there shouldn't be any health impacts, but we want to be able to provide some sampling data to say, here's what the air qualities will say, and we'll have those companies prepare a sampling plan and suggest to us this is what we need to do to achieve that end. And so that's what we've spent, portions of the weekend and today especially, and a little bit of last week, nailing down and trying to move forward in addressing the concerns of the residents. And so that's my report for now.
Thank you.
I think we had a couple people join, so I don't know. Who's joined the call?
Hi, it's Mary Francis.
Okay. Is there anyone else on the call? Okay, thank you. All right, Henry, I hear you in the background.
So, yeah, thank you.
So I met most of you, Rob Greer, Assistant Director for Environmental Health. Last time I was here, I think it was in June, so I'm kind of just going to work back with some of the, I guess you can say, big items that we've been working on. We always doing restaurant inspections, housing inspections, and so forth. During the summertime, towards the end of the summer, we met with Police Department, Fairfield University, the Select Women's Office about Fairfield Beach Road and the students down there and so forth. We were actually provided by Fairfield University a list of different addresses that were being rented. Some of the staff, including the engineer, worked on the addresses that potentially did not exist, because in the past, students would give addresses that did not exist, and they kind of just slid under by everyone, and then everyone was okay with it. So we worked on that. We made sure that we cross-referenced all of them. And Fairfield U's been really good about it. Police has been working really hard with, the complaints down there, overcrowding. And fortunate so far this year, we haven't received any complaints on any overcrowding down there, because during even last year, the years before, we received tons of complaints, which always are big problems. But so far, so good. So I think what we've done, what Fairfield U has done, what Police Department has done, the Select Women's Office has done, has worked out great. So we did that. Another thing that we were working on during the summer, and we had the staff kind of work on it, down in Sherman Court area, we've seen an uptick in rodent complaints. So that area there, this turnaround area, the horseshoe area there with the condos, there was a bunch of complaints about rats down there. We did go down there, we did verify, I did that there were rats there. Tina, Melissa, we all went down there with flyers, put them in their mailbox. It was ongoing for maybe about a month or two during the summertime. I actually received an email today from one of the residents that said, putting the procedures in place and the follow-up way, remove your compost pile, don't leave any trash out, so forth and so on, really worked. And they said they haven't seen any, but for a little while it was an issue down there. And it's one of the things that she said in the email is there's a restaurant that's up further and their dumpster smells like seafood and food waste. Can you go talk to them? And it's kind of like, we will, but it's a restaurant. It's going to smell of those things. So we were dealing with that during the summer. Other things that we dealt with is we had several hoarding complaints, two that I worked on myself. The lady that was living in the condo did not have to be removed or brought to the hospital. She refused to leave. They did clean up the area. We made sure that she had all her plumbing working. So that worked out well. But we had 5 complaints of hoarding over the last probably 4 months. So John Oldham in our office actually worked on one this past week. He worked with the husband who does not live with the wife in the townhouse that she lives in, and he cleaned it up over the weekend. So we've been really fortunate because the last time I think I reported it was one that we had to have them removed, put in a hotel for the time being. These were not quite to that level, but we did have to work with fire department and police department, got some of them cleaned up. There was one that was a very unique situation that husband and wife, it's a very long story, but there wasn't any hoarding there, so we didn't really have to worry too much about that. We've also been working with State DPH on a radon program. They provide us with radon test kits. We actually asked for 100 of them, which were substantially more than we asked in the past. Debrina and Kim in our office handed them out at the flu clinic, and then they also worked at the main library, and they handed out all 100. We're starting to get back some reports. Debrina, the new sanitarian, I don't know if you told them that we hired him.
We shared that last month.
Yeah, so the new sanitarian, Debrina, has been placing calls to the elevated houses that have elevated radon. She's been working with them for more educational material. So that's actually going well. The state was pretty happy when we asked for 100 of them. I think they were a little surprised that we asked for 100 of them, but we were able to give them away. So that actually worked out really well.
Does the state provide any grant funding for mitigation of the radon, since they're providing the kits also?
That I'm not sure. I don't believe they do. It's radon awareness. They give out the kits. They'll run the testing, educational material, but not any funding for mitigation.
Testing's free.
Testing's free, yeah. And then if you get the elevated test level,
Sorry, yeah.
and then you have to decide what you want to do. So,
but there are programs in town, like through community economic development, that can assist with those types of things if the individual doesn't have the means to do it.
Okay, so there's help out there. It's just not.
The state program doesn't provide it, but there's other resources available that people can tap into if they need it.
The systems are not that expensive. They're about $1,200 to $1,500 installed. A lot of people think they have radon, they're going to spend all this crazy money. It's not anything that's over the top, but that was a good program that we were able to hand out 100 test kits. And just moving forward, over the next couple of weeks, we'll be mailing out our license renewals for food establishments. We usually do that right before the holidays. And then, we've been dealing with the smell issue for the last 6 months, but beyond that, those are really the major items that we've been dealing with on the environmental side.
Yeah, the complaint came in a while back about the composting facility. So we started looking at that, and really, Rob and some of the other inspectors have been going down on a regular basis to Fairfield Beach Road just to, take a swing through and see if they notice anything at different times of day, and really hadn't been picking up on any consistency to the complaints. An odor here and there. The area around the sewage treatment plant was never odor-free, and they found it every now and then an odor, but not necessarily a strongly objectionable odor like what's being experienced now. Now it's different in nature. It's just more of a really strong objectionable odor, and it needs to be addressed.
Strong.
Yeah.
I can smell it from my house.
Yeah. And it's different than it's been in the past.
Right.
Yeah, so we think it's some component of related to both the failure and the efforts to control the odors. So they're introducing an odor control system, trying to change that, and that's causing different reactions. And so that's, I think, part of it. And so we're trying, they're working with the subject matter experts in that area to kind of get that under control, and we're trying to address the health impacts aspect of it.
A couple of the restaurants opening. Sally's is opening this week, so they're finally done.
Yeah.
Fairfield View Arena, we were out there today. They're opening Friday, I believe.
They already have billboards on the highway, yeah.
Yeah, I guess they have a women's game this Friday, and then they're playing Michigan, who's ranked, they were explaining to me.
Wow.
So they're pushing, because they want everything open ASAP, so, and then Sacred
Well,
Heart.
the hockey arena is the one I'm talking about, I think has the
Yeah, Sacred
billboards on the highway.
I have to go there Wednesday. I'm not quite sure if they're ready to open, but they're pushing too, they want to get it done,
I mean,
so.
it's right on the campus, it's right in the main campus.
Fairfield U?
The GE campus is where the Sacred Heart one is.
Right, but for Fairfield,
It's right on campus. It's a beautiful arena.
It's the old,
It really is.
Is it like the alumni hall or whatever? Is that
yeah,
where
it's
it
where
was?
the basketball
Yeah.
court used to be,
Right.
they've just expanded.
Sacred Heart has a hockey arena that's going in that's, I mean, if you looked at the plans, it's nice. It's a huge, so I'm going there Wednesday because they want to talk about concessions, but Fairfield U built a new arena right on their campus, the basketball arena. It is a nice arena, like when,
that's great.
yeah, I was there today. It was pretty nice looking, so.
Huh.
That, and, that's it. Sally
Yeah.
is finally
Sally's,
over.
We'll see.
It's over, it's not that far.
It's
You
right
remember
there.
what-
Barbacoa was right on the
Yeah.
corner.
It's New Haven, yeah, you know, it's right in the trademark
Funny,
Oh.
'cause Pepe's is down
building
the street.
across the
Yeah,
street.
it's funny because Sally's has two locations. They have a dine-in area, and then they have like a takeout. And I said, why do you have two places like next door to each other? And they said that they had to take it in a lease, but it's a nice place. So it's been,
That's pretty typical in New Haven, pizza places, like they'll have like, this is how you enter for takeout, get your stuff, this is your
yeah,
dine-in, you know?
yeah, it's,
People will go,
A lot of pizza places
Sure.
in Fairfield now.
yeah, but I mean, people will go because
Yeah.
it's like a name brand, like Sally's, Modern, Pepe's, you know, they'll go.
With the rodents, are there ever any efforts to catch and remove them at all? 'Cause I mean, it seems that if they're gonna, you know, be deterred from one neighborhood, they're gonna go somewhere else, right? You're never really gonna, if you're not somehow eliminating them, you know?
Yeah, so
Everyone's
we'll
government
suggest,
undertaking, or-
you know, we'll suggest if you have a rodent problem on your property, you need to hire a pest control operator to try and get that under control. But we want to take away food sources, water sources, harborage sources. That's the big part of it. And then, if they're stubborn there, if you've got burrows in your yard, you need to hire a pest control operator and get that under control.
So it's really on the residents, the town doesn't take any kind of
Yeah.
efforts in that regard.
complaints in the past, there was one down that was right off of, all the way down Oldfield Road. You knew where it was. They had chickens, the feed was out. But then nobody wants to say anything, and then they see rats in their yard, and then it's like, okay, and you could go to that owner and say, hey, listen, you're the source, like, you gotta clean it up. This was kind of unique, because they were just all over the neighborhood.
Yeah.
And they all pitched in, they did what they needed to do, and, it's taken care of now, so.
Thanks, Rob.
Yeah.
That's good. So are there anybody get any communications from anybody, these Fairfield citizens? I haven't gotten any.
No, I think everybody's just in like neutral zone right now.
There was just that one email that came to the Board of Health. I believe you all got that. That was the only thing that was there, but I responded to that.
Oh, yeah.
I didn't see that this time.
I'm trying to remember.
It was just recently, right?
Yeah, it was just recently, like last week, there was an email that came to the Board of Health email address, but that,
Yeah, I forgot what it was about, but, yeah. It was in-
I'm drawing a blank right now. I meant to print it out, but I'm drawing a blank on it. But I know I responded to it, and it was a small issue.
Was there any old business that you wanted to finish up on? New business?
So just, you had a chance to review the report. I said I wanted to make some editorial changes to the annual report, but I didn't have a chance to, but I'm just at this point saying I would like to put a button in that and finish it up and just get it approved, and so we can file it and move on with, because we're already at the point where, because the one I'm asking you to approve is the 2021 annual report. So we're already ready to move on to the 22, so just kind of want to put that behind us. So if you could, consider that. I mean, I didn't receive any comments from anybody to make any edits, changes to that current one, so.
I'll move to finalize the annual report for 2021.
Second.
All in favor? Any opposed?
Passes unanimously.
There you go.
Unanimously passed. Yep.
Okay.
Great. That is excellent. So any other comments about anything that's come up in the last month? Then, anybody have a motion to adjourn now?
Alice is a motion to adjourn.
Second. All right, great. Thank you very much, both of you. Thank you.
Thank you.
for all the work you did.
Sally,